Welcome back. So, we have looked at disease surveillance as an application area, and we have looked at health risk assessment or health risk analysis as one other application area, broad application area. Uh, let's now move on to the two remaining aspects out of the four broad categories I highlighted. Another important aspect of GIS application in health related studies, health access and planning. Essentially, the goal here is to try and understand how communities, people access healthcare facilities or services and use that to create better planning for provision and delivery of these services. So, community access to healthcare is very important if we want to maintain a healthy society. So, the capability of the community to use the healthcare services or facility when it is required is very important. So, the idea behind that is that we need to understand what are the variables, what are the factors that is associated with the need of the people for healthcare facility and the implementation of that healthcare facility or services. So, which means what people need and how they get it. So, for example, we might be assessing the population's need for antivenom treatment site. For example, in places in some parts of India and some part of Latin America where snake bites, and even in Australia where venomous animals uh, and snakes are abound, there's a need to understand how do people access this kind of facility, at least, for example, antivenom sites, maternity care services, primary health care services, or facilities, and so on. So, healthcare access and planning is one of the major important area in which GIS is very, very valuable. So, that was an example of a work that I did with a colleague from the University of Port Harcourt Teaching Hospital, which was published in 2019. We look at geographic accessibility to primary health care, specifically for Akwa Ibom State, and we model geographical access. However, we also recommended that there is a need to look at other dimension of accessibility because something may be close to you, it may be available to you, but economically it may not be available to you. So you may not be able to afford to get the services, even though you have access to it. So access has so many dimensions, but we focused on geographic access. There's also an interesting work on variation of in health access. So, done by Comba et al. In 2011 is an interesting piece of work. I'll advise and I'll suggest you give it a read. So, they look at long term illness. So, they administer questionnaire to look at how people perceive their access. And from the analysis, they realize that long term illness, bad health, and non car ownership are predictors of access to general practitioner, doctors, and hospitals. However, for geographical distance is not a predictor for access to hospitals. So, which means people even travel further away to get to hospital. Geographic distance does not limit them. However, geographic distance is a predictor of access to general practitioner. So, these just showcase what is possible when it comes to using GIS to understand access to healthcare and planning for healthcare because the outcome of analysis of the access is to improve the planning for that healthcare and healthcare service delivery. So, next and the last aspect or broad group is the community health profiling. And I hope that maybe from this exercise, maybe this might stimulate some of you in trying to develop a framework for your respective states, local government, and so on, a health community health profile. So, community health profile (CHP) has to do with compiling mapping of information about the health of a population in a community. So, go beyond just talking about their health in terms of ailments, diseases, and things like that. It is much more comprehensive about the status of the general well-being of the population. So it's not just information and data is not collected only just for traditional health measures. There's also the aspect of social, demographics, and economic uh, well-being of the people, because human beings are such complicated being and unique being in the sense that it's not only how we feel in terms of our health. There's also the aspect of us, how we feel within where we live. It can also impact on our health. How we feel about our jobs, about our situation can also have a significant impact on our health and well-being. So the goal, therefore, for CHP, community health profiling, is to improve the health of the community and stimulates participatory public health, because by letting people know and providing an understanding for people and practitioners on the general well-being and the holistic well-being of the people, there's an opportunity to plan better. For example, there has been uh, some works that showcase uh, areas where there's a high rate of obesity and diabetics. So that gives an understanding that there is a need to do something in terms of planning for access to healthcare services that will improve the health outcome of the people and the general outcome of the people, health outcome for the people. Uh, if your human uh, resources in any nation, if they are not in good health, then economic and social development can never be guaranteed. So this is where health geography and health related studies becomes very, very important, because a lot of uh, studies have shown that economics is not the only thing that makes people that makes nations develop. The development of the human capacity in all its ramification also is an important aspect of development. So I have some examples there for you. I'm not going to go into those websites, but I put those links there to help you see some examples of how um, health profiles, what it looks like, especially looking at the geographical part of it. So this is just a snapshot of for England, and you can see the places. These are crude rates of people killed or seriously injured on the roads in England, not the United Kingdom. So excluding the other home countries. So we have areas spread. The areas in red are areas with very high rate. So this gives an indication of where places where the outcome in terms of being killed or seriously injured on the road are higher or worse than 95% of other places. And we have the green areas where they are better than 95% of other of the places across the country. So this is an interesting perspective, and allows for quick understanding of what is happening across different parts of the country. So community health profiling, an important aspect of understanding getting a broad understanding of the health status of the people. So, how and why do we need to look at spatial dimension when it comes to health? And the question could be reframed as why do health outcomes or health related data or incidents differ from random? There are two fundamental reasons. Some places are more receptive to certain uh, vector that carries certain diseases. A very good example would be malaria. If you look at the map, a look at the map that I have here shows that across the world, where are places that are suitable for certain species of vectors. So, with that, it means that diseases being carried by those vectors are likely to be more uh, prominent in those areas indicated in red, blue, and so on. So, receptiveness of a place affects the occurrence of certain incidents in certain places. And this is very important for diseases. You look at COVID-19, cancer, flu. So, cancer cases will cluster because the environmental hazard or chemical plants or things like that that are causative factors for the disease or ailment also clusters. Okay, then we refer to that as the first order effect. The second fundamental reason why processes or disease or health outcomes cluster also has to do with interdependence of points themselves. So if we look at that, diseases cluster. So incidence of the number of diseases, incidence of diseases that you will find, certain diseases you will find in a place cluster because people catch them from other people who have the disease. So if somebody has COVID-19 or somebody has cold or flu, they're likely to transmit it to people who are closer to them. So interdependence. So because we live in a society, in a community, we have close interaction, so we are interdependent on one another. So me having the disease and coming in contact with you is likely to transfer the disease to you if you are susceptible. So we refer to this as second order effect, whereby the disease clusters because people catch it from other people who have the disease. So the transfer of the disease is there is an interdependence between the disease and the connection to other people. So these two reasons makes it very important for us to look at disease and health related outcomes from a spatial perspective and makes it important for application of GIS. So we'll stop here again and I'll join you shortly again. Thanks. See you shortly.